were hoping to get your help, actually. He's a complex oncology patient.
Let's go up to the NICU first, because I really can't wait. We do a frozen section, we can go look at it, have an answer within 10 minutes.
The Hospital of the University of Pennsylvania has the largest inpatient dermatology consult service in the country. Its director, Dr. Misha Rosenbach, is one of only 2 dermatology hospitalists in the U.S., board certified in both internal medicine and dermatology. Dermatologists are the experts in diseases of the skin. A less well-known component of the practice of dermatology occurs in the hospital. As a major academic medical center that cares for seriously ill patients with incredibly complex conditions, the Penn Dermatology Hospitalist plays a critical role in caring for patients admitted for severe forms of skin disease and for making the diagnosis of potentially life-threatening diseases and adverse medication reactions.
Hey, Marcus.
Hey, Dr. Rosenbach. How are you?
All right, what do we have today?
So we have a number of follows from yesterday. I just got a page from the MICU, another patient there who has a nodule on their toe. It's blue.
Okay.
It sounds like he had a lung transplant about 3 years ago, but is on intensive immunosuppression with 3 different agents. And this just came up over the last day. He's had some altered mental status, difficulty breathing, and so that's why he was admitted. I know they've had some issues in the MICU before that we helped out with fungus, and it sounds a little bit suspicious for that,
Yeah,
which is why they called. So.
Absolutely. Let's go up to the MICU first, because I really can't wait. And after we do the MICU, then we can go see the vasculitis and maybe the graft versus host.
Okay.
All right, let's go.
Good.
Hi, Megan.
Hi, Misha. Thanks for coming up so quickly.
Yeah, thanks. So what's going on with this guy?
We were hoping to get your help, actually. He's a complex oncology patient who had these purpuric raised lesions that I remember from another case that you taught me could be a systemic fungal infection, and we were hoping to get treatment pretty quickly.
Yeah, that's a really important pickup. It's good. So where are the spots?
They're actually diffuse, mostly on his trunk. I would say 4 or 5 in total on the upper extremities.
Yes, no, I think it's really good that you called us and you said he's out of it, his mental status.
Yeah.
Okay. Yeah, so I think we should go take a look at the spots because certainly could be concerning, like an infection or a fungal infection even, and we'll probably do a frozen section and then let you know what we see. If we see fungus, obviously that might direct us towards some alternate imaging or treatment. So
Perfect.
We'll go take a look at and we'll let you know.
Great, I appreciate it. Thanks a lot.
With increasing reliance on technology, the art of physical diagnosis is fading. Dermatology is one of the few fields remaining where the physician's experience and visual skill is absolutely critical in recognizing the disease and making the diagnosis.
I was brought in with a very bad rash all over my body, as well as high fevers, joint pain and everything. And having Dr. Rosenbach and his team available for me at that moment was very critical and very important, and they helped me and they saved me.
We went to many different kinds of doctors to try to determine what was going on with this small lesion that just kept growing and growing and growing. The difference that the dermatology service made in my mom's care is that it absolutely brought her from one track, which was surgical debridement, to a track of eventual healing.
So I'm really worried about this blue nodule.
Yeah, so what are you thinking?
Well, I'm actually really worried about an invasive fungal infection. I remember the last time that we saw a guy like this, you recommended doing a frozen section.
Yeah, absolutely.
It ended up probably saving his life because we caught it early.
Yeah, so in patients who are this immunosuppressed, the mortality rate for certain angioinvasive fungal infections is 60 to 100%. If we diagnose it early, like with frozen section, we can get an answer within 10 minutes, start the right therapy. He might need wide local excision, hyperbaric oxygen, supportive, GCSF, colony stimulating factors. And if we're thinking fungal infection, we should also get an MRI to see what's going on in the brain. But first things first, let's go do the frozen section.
Okay.
Dr. Rosenbach has been a dermatology hospitalist for 5 years, and under his directorship, the service has tripled in volume to over 1,200 consults per year. He has more inpatient experience than anyone in the region.
I am a transplant infectious disease specialist, and I'm actually the director of transplant infectious diseases at Penn. One of the things that I've been most impressed about throughout my time in infectious diseases how important the skin exam is in diagnosis in patients who are immunocompromised, so who've received transplants or who are critically ill. And one of the great services we have here at Penn is the dermatology service, which actually is an inpatient service that will come see patients very quickly and help us with diagnosis.
In this case, he and the dermatology team immediately recognized the purple lesion as a possible life-threatening fungal infection that would require a rapid change in the patient's antifungal medication. Within minutes, the dermatology team performed a biopsy at the bedside for frozen section, a technique that allows the biopsy to be processed and reviewed almost instantly. The frozen section confirmed Dr. Rosenbach's clinical impression, and the patient was diagnosed with an invasive fungal infection. The imaging study recommended by Dr. Rosenbach also confirms that the cause of the patient's mental status change is due to the same fungal infection present in the skin. The total elapsed time from the consult being called to the diagnosis was less than 60 minutes.
It was a great service to me. It helped me get through what I needed to get through. The doctors are awesome. Definitely a vital asset. Get the word out there.
So Dr. Rosenbach and his entire dermatology team was the difference, truly. I mean, if it weren't he who was visiting or interfacing with my mom bedside, it was one of his associates, and they really were the difference. They directed even the medical team, honestly, at different points of our hospitalization.
Inpatient dermatology is an essential hospital service. Patients are admitted with life-threatening rashes such as Stevens-Johnson syndrome or toxic epidermal necrolysis and DRESS. At Penn, they receive immediate intervention with the most up-to-date, cutting-edge therapeutic options. Over the past 5 years, we have a 100% survival rate for toxic epidermal necrolysis, the most severe drug reaction, where worldwide 30% of patients die. The dermatology service plays an integral part in the care of oncology patients, providing the necessary guidance in identifying which of the patient's many medications is the cause of a patient's rash, thus preventing potentially life-saving drugs from being stopped unnecessarily. Dr. Rosenbach and his team are also charged with managing the most challenging, acute, primary skin problems, such as pyoderma gangrenosum, and using state-of-the-art cutting-edge therapies, they can control even the worst cases of skin disease.
My mother's medical outcome is a great success story. It took a very long time and a lot of commitment and a lot of creative thinking clinically, but I think her prognosis is very good. The wound is healed, and life is returned to normal.
I was very grateful that the Dermatology Department was available to me when I needed it, because I was at a lost cause. Nobody knew what to do with me.
The case that we selected to highlight is not an uncommon one, but rather an everyday occurrence. The inpatient dermatology team plays a critical role in the functioning of the hospital. Whether it's recognizing a mild cutaneous adverse drug reaction and allowing a patient to stay on a potentially life-saving therapy, or identifying a subtle skin lesion that can suggest a widespread systemic process with internal organ involvement, like vasculitis. The case that we discussed was a patient who had a mild skin manifestation of what was a widespread systemic infection, and rapid diagnosis allowed targeted therapy, early intervention, and markedly improved patient outcomes. Dermatology inpatient service plays a critical role in the functioning of the hospital.
My outcome after I would say the last, coming from the beginning to now, unbelievable.
It's a vital asset to this hospital. I'd be lost without it.
My feelings about the dermatology team and the entire staff is the one of just extreme gratitude, and I'm very clear to say that I believe they saved her life.
Penn Dermatology, leading the way since 1874.